President Biden got his booster shot of the Pfizer vaccine today, saying that while boosters are important, the most crucial thing we need to do is get more people vaccinated. Meanwhile, officials are taking drastic action now to prepare for mass firings and staff shortages at New York hospitals as the state's healthcare worker vaccine mandate takes effect today. It's estimated 72,000 unvaccinated hospital workers could lose their jobs for refusing to comply, and the governor is prepared to bring in state workers, even the National Guard, to help. Let's bring in Tom Quattrochi, the president of the Erie County Medical Center Corporation there in New York, along with Dr. Darian Sutton, our ABC News medical contributor and also an emergency physician. For more on this, Dr. Sutton, let's start with you. President Biden continued to stress that while he was happy to get his booster, this is still a pandemic of the unvaccinated. So how important do you think it was for the president to get that booster shot live on our air as America watched?
I think it's incredibly important for anyone with a public platform to express their trust in science. And we know that the president is 78 years old and more than 8 months beyond his initial dose of the vaccine. So he's listening to the science, which shows that he has some additional protection with getting an additional shot. But we also know that vaccines continue to prove effective regardless of someone's age or their medical history. And just to add some numbers to this, of the more than 181 million people who have been fully vaccinated, only approximately 19,000 have sustained a breakthrough that has required a hospitalization. And of that small fraction, the majority are over the age of 65. So the president is listening to the science and understands that he obtains some additional benefit. But of course, like he said, we cannot distract from the primary issue, which is that the unvaccinated are the primary source of infection, hospitalization, and current death rates.
Vaccinated are obviously healthcare workers. That's an issue that here at the White House, the White House Press Secretary Jen Psaki was asked about the situation in New York there, the vaccine requirement for healthcare workers. How is it affecting your facilities? How concerned are you about it? How many workers do you think you might stand to lose because they don't comply with the vaccine requirement and don't want to get vaccinated?
Well, I have to say, Terry, that in my personal
through the pandemic, and one of our issues is staffing. In general, let alone with the vaccine mandate. We're in favor of the vaccine mandate, but feel we just need a little more time to work through some issues. We have about 5% of our workforce, and while that may not sound like a lot, the bottom line is that we already have a staffing shortage to begin with and have over 400 positions open. One of the other things that's happening is downstream, the nursing homes really are having issues. So our nursing home has about 20% of its workforce that's going on unpaid leave as of today because they have not received a vaccination. That's happening all over the community. So we can't discharge patients into the community, which ultimately backs up our emergency rooms. So it's a real concern. Again, we're trying to work through the issues. We're trying to educate people. We're trying to explain them the importance of getting vaccinated, but it continues to be a challenge for all of us.
And Darian, one argument you hear from healthcare workers is that so many of them have already had COVID, so they have some immunity and don't need the vaccine. Do they have a point?
I understand this point, but there are some faults to this argument. I'll first say that someone who has had a relatively recent infection has a very low risk of getting a reinfection within the first 3 months. But there are some issues with that. We've seen in studies that those who have had a natural infection have variable responses to the infection. Some have elevated antibody levels, and we can presume that they have more protection, and others do not. And we also don't yet have a test to determine who is immune and who isn't. So with that being said, the safest, lowest risk option still remains to get vaccinated. And as healthcare workers, we have an obligation to take care of our vulnerable patients and not spread additional disease. And so this isn't new for us to require something like vaccinations, as we have medical clearances for other diseases that we commonly have to go through on a yearly basis.
And Dr. Sutton, if I can follow up on that, there are all kinds of reasons people might not get vaccinated, libertarian reasons, some people misinformed, whatever, religious reasons for some. But healthcare workers, can you help us understand why a public health worker would choose not to be vaccinated? And have you seen that in your own work, given all the available information that they've got working on the front lines about how effective and protective these vaccines are?
Well, Terry, I have to say that I have seen it in small percentages, albeit, but I have certainly seen it. I know that in my large tertiary care hospital here in Los Angeles and the hospitals that I've worked with in New York City, we've seen lower rates of this. And I think that the farther attached or the farther associated someone is to a surge in COVID-19, the more likely and more susceptible they are to misinformation. As healthcare workers, we're not immune to misinformation. And some of us require a little bit more help to parse through the information to feel more comfortable in the decision. But it still stands that vaccines are proving effective. And if we have to, we use science in every other format in medicine, and we have to use it in this discussion. And we know that those who are vaccinated have a lower risk of infection, and therefore we can assume that they are lower risk in transmitting that virus and to our vulnerable patients who are immune compromised and immune suppressed. So it still stands that vaccines are proving effective and they work and they should be used in hospital care systems.
And Tom, state data shows that 84% of hospital workers in New York are fully vaccinated. So what impact could this requirement have statewide?
Well, again, it goes back to the staffing shortage. We're all very concerned that we're going to be able to take care of patients. And we're working with the state hand in hand to make sure we do get individuals vaccinated. But we're going to have to get obviously more aggressive when it comes to recruitment in the short term. We've tried to work with agencies, as you can imagine, all over the country. Agency employees are being scooped up, and the price per hour keeps going up and up and up. So it's a real challenge, but the impact is going to have to be watched. We're going to have to see if there's some mitigating things that we can do to ensure that we have staff to take care of patients, and we're working very closely with the current New York State administration.
And let me follow up on that with you, Tom. So Governor Hochul, your new governor there in New York, she said she's prepared to send in the National Guard to help you out and help fill these gaps. That's just an extraordinary step. I don't know if that's happened before in a public health emergency like this one. Would you welcome that in Erie County, do you think? What would that look like?
We'll take all the help we can get. At the end of the day, we need nurses. That's really the most important person that we need in our healthcare system to be able to take care of our patients. And a significant amount of nurses have said that they won't get the vaccine. We shouldn't forget the 95% of the individuals that said they would, because that's very important. We should applaud them, and they continue to work here and work very hard and pick up extra shifts. But you know, at the end of the day, we need healthcare professionals, and we'll take the National Guard or whoever else can help us. If it's other nurses from downstate, that's been talked about also to help us up here. Whatever the case may be, we're obviously working with Governor Hochul and their team around how we can mitigate some of these circumstances.
And Darian, meanwhile, vaccine requirements are causing issues in the NBA. Brooklyn Nets star now, Kyrie Irving, missed the team's media day today due to COVID-19 protocols, declining to share his vaccination status. What do you think about this? What would you tell players who are skeptical of getting the vaccine in such close quarters with other players and fans? And how can teammates or friends help convince others?
I would remind them that although the risk is lower, given the fact that these professional athletes are in the best shape of their lives, the risk is not zero. And we've seen evidence of long-term effects of COVID-19 as well as acute effects of COVID-19 in healthy individuals. And so we know that COVID-19 vaccines are proving effective in preventing disease, but also as a professional athlete, you're traveling around the nation, you're in close contact with fans, and you're working out and breathing at higher rates with your teammates. And so there's an increased risk there. And so I think that the best way to protect against that is to get vaccinated. But I do think that it just probably requires some time and some patience so that someone can feel understanding in their information around them and comfortable in their decision.
Dr. Darian Sutton and Tom Quattrochi, gentlemen, thanks for the great conversation.
Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.